Welcome to Conversations on Healthcare. This week we welcome veteran news anchor and host of CBS Sunday Morning, Jane Pauley, along with Marc Hackett, who runs the community health centers in Indiana named after her. Now, here are your hosts, Marc Masselli and Margaret Flinter.
Jane Pauley has built a trusted legacy with American TV viewers since she first appeared on the Today Show. Her boss once complimented her on an even-keeled personality in an industry known for big egos. In recent years, Jane has opened up and shared details about her health issues, and that openness has created even more connections to all of us. Her link to health includes lending her famous name to the Jane Pauley Community Health Center in Indianapolis area.
Also joining us today to talk about the important work of the Jane Pauley Community Health Center is its CEO, Marc Hackett. They have been awarded federally qualified health center status. They now have 12 sites in 4 counties of Indiana.
Well, Jane is on with us on audio, and we appreciate it. And Jane and Marc, welcome to Conversations on Healthcare. You know, Jane, you grew up in Indianapolis. You went to Warren Central High School, graduated in 1968, and you probably weren't thinking back then that the community would honor you with the naming of a community health center after you. I wonder if you could tell us about how that naming came about.
I wasn't anticipating anything that transpired, getting a job, much less a career, marrying a cartoonist, the diagnosis at the age of 50, and much less the clinics with my name on it. The original clinic is about no more than a mile from where I grew up. So I am very much a hometown girl. You're good to know my high school, Warren Central. When I was in high school at Warren in 1968, when I graduated, we were a powerhouse in no athletic endeavor, but in speech and debate, big time. And so I had gone back I don't even know exactly what year it was. Marc might know exactly. Was it 7 or 8 years ago? But to celebrate the first state speech and debate champions in 40 years since my era. And after we posed for that yearbook picture, the superintendent of the school introduced herself with a folder under her arm, and she said, and I quote, "Jane, we've got a proposal for you, and I'm not asking for money." But then she explained that were building a health clinic, a community clinic in a school. I knew that there were school-based clinics all over the country, but this was a community clinic that happened to be in a school because she had a school with space, and I knew a little bit about community clinics. I had some experience, and it brought. I literally, I kind of choked up at the invitation to put my name on that single clinic. And 6 months later, I was cutting a ribbon for the Jane Pauley Community Health Clinic, and nobody anticipated that there would be a dozen or more in the future. Credit for that goes to Marc Hackett and his team. So that's how it happened.
Well, Jane, we clearly share a lot of interest, and one is a passion for school-based health centers. They're so important and at integrating medical and behavioral health and oral health. So thank you for sharing that story. You know, you've been a pioneer and a groundbreaker in many ways in the course of your career. And one of the ways you've been a pioneer is in speaking openly about bipolar disorder. And this has really made a difference, I think, for our country. Could we ask you to tell your story so that we make sure that those who haven't heard it have a chance to hear?
I'm not famous for long story short, so I'll try to keep it short. But Mark, when you said that I had a former boss what he specifically said was that Jane Pauley had the best mental health in the business, and this was no other category what he had said the best anything in the business. But at that time, I being a Midwesterner, humbly agreed. I had a reputation for being normal, and normal was an adjective that would be used in profiles of me, and I've got the clips to show for it, until I was 50 years old. And I had a medical encounter that revealed an unrecognized or unmasked, an unrecognized genetic a vulnerability to a mood disorder. So I was not bipolar when I was 49, but when I was 50, boom, I was, and I am. But as a journalist, I learned everything I knew about mental health pretty much in the mid to late 90s. President Bush, you remember, declared the decade of the brain. I did not have known family history. Family secrets can sometimes be the same, but so everything I knew about bipolar, I pretty much learned as a journalist, and recognized that with my reputation and at the age of 50, stood little to lose and had a big opportunity when I got better, and I knew eventually I would, that I would tell a story and that it had some potential to have some impact. I didn't, exaggerate the potential impact, but it has been a very important advocacy role, and I think one of the reasons that I was invited to share my name was because the first Jane Pauley community health clinics would have the behavioral health component, and that perhaps knowing my story would invite people to take advantage of those services. I've since learned that most people who take advantage of the services that Mark and his team offer don't know who Jane Pauley is or was. they're just glad that the clinics are there for their use when they need them.
Well, that's so good. Well, thank you for throwing that pebble into the pond, because it's washed across the shore of so many people all across the country. And I love the fact that you were saying, "Hey, I cut one ribbon, and then all of a sudden there are 13, and they grow, they proliferate." Our health center, we're celebrating our 50th anniversary this upcoming year, and we know that story. I'm struck though that even if, and Mark probably knows this as well, but Jane, you go down the street from the health center and people don't really understand the value that community health centers provide across the country. And nationwide, as you may know, health centers care for 30 million people, yet they're the least known health system in the country. And we are so appreciative that you've lent your name. Any thoughts about how this good work, no different than yours, that pebble that gets thrown into the pond, could help spread the message?
Well, that's why one of the reasons I go back and cut ribbons, though I don't have any role to play in the provision of services. I'm not a healthcare professional or even a professional advocate, but I absolutely know that if cutting a ribbon at the new center in, Greenfield, which happened to be my father's hometown east of Indianapolis, if that is an opportunity to discuss community health clinics, then by all means, roll camera. But it also shows the proliferation of clinics in central Indiana, and especially the east side of Indianapolis, where I grew up, it tells you about the need, the absence of, because access to healthcare in our country is a barrier to healthcare. And if people can't get to the hospital, get to the ER, where, as we know, are overused services around the country, then that is a barrier to their getting healthcare. Opening a clinic, in their community means that they actually have access to top quality doctors, nurses, oral and behavioral care. So it really, Marc has revealed how necessary and those services, and how missing apparently that they previously were. People need them.
Jane, you've, as you pointed out, you're not a healthcare professional, but you bring such a valuable perspective as a patient, perhaps first, and as a journalist. But we're looking at surveys, a recent one that showed less than 3 in 5 Americans trust the U.S. healthcare system, and that was a significant drop over these last 2 years. What do you think we in healthcare need to understand about what people need from us right now? What's missing beyond access? Where does this lack of trust come from, do you think?
I'm gonna say I don't trust that survey. I think it's a little like the way people feel about the media. I think the media probably does a lot worse than in those polls, and yet people trust their local news teams. I like the people that I watch at night who tell me what the basketball score was. They trust their own. And I will wager that the people who mistrust the nation's healthcare system very much trust the doctors and nurses at their doctor's office or their community clinic or their ER, that on a local one-to-one basis. I like mine. I just don't trust those other ones. That's my read.
That's such a great observation. I think we've heard it that, I hate Congress, but I like my congressman or woman who's
exactly.
there, which is so good. I think there is a problem, though, and Margaret was alluding to it. I think over the last couple of years, there's been sort of a general distrust of public health in some ways, not completely and across the board. But it does have people, I guess, questioning, should I get the vaccine and the other things? Any thought about how we try to find the seam of cooperation amongst disparate views? I mean, it's so important when we're facing a pandemic to figure out how we talk not at each other, but to each other, right?
Yeah. I'm afraid I kind of think it's personality driven, and as long as there are very strong and effective personalities who have an agenda that is otherwise, I think that the status quo you described is going to stay. But I think the wind can shift. I've never kind of had that thought that I've just articulated before. It came out of my mouth. So in the long run, I'm very optimistic that we regain the trust my parents had in Dr. Collins, who was our pediatrician, but it can be undone quickly, and doing it up is probably going to take some time.
Mm-hmm.
Well, let me turn, if I can, to Marc Hackett, the CEO and executive leader of the Jane Pauley Community Health Center. And Marc, I'm curious, Jane has been very modest about the impact of her name, maybe in its public awareness and recognition. back in her hometown. But I wonder, from your perspective, what difference has it made to the awareness and acceptance of the services that you are delivering there in your community to have Jane's name connected to this work and organization?
Sure. Thanks, Margaret. And to Mark, to back up your point, I hear it every day, and I hate hearing this news, but we're always here. We're the best kept secret in town, and we don't want to be the best kept secret in town. People, once they get in our doors, they see the services that they're able to offer, and Jane's name just opens up doors for us. Jane, you'll be tickled with this, but like we have a new employee orientation every 2 weeks, and I had one just this morning, and I give out door prizes, little Starbucks gift cards, and I asked them, Jane, do you know who Jane Pauley is and where she works now? And it's interesting, some of the responses I get.
Yeah. Okay, we'll talk later, but I'll bet a lot of them, I'll bet you would say, and they just drew a blank.
Yeah, there's certain executives, if they don't know who you are, I'll just pass on them. But yeah, some of the younger crowd, I just remind them she's still out there. Tune in on CBS on Sunday mornings. But
Mark,
but yeah.
I'll just say my sister came back for a high school reunion, and the directions to the location featured a turn left at the Jane Pauley. And the Jane Pauley has become a franchise, irrespective of who I am.
Nice. That's nice to hear. But yeah, Margaret, she's opened up doors. Jane hasn't done anything out of the ordinary that would put her name in jeopardy or whatnot. I mean, she's a local gal, just really well respected in the community here, and that is really looked at as a very positive, having her name affiliated with her organization.
Oh, that's great. Boy, this last 2 years has had such an enormous impact on everyone, but certainly young people, and, so many lost opportunities that have happened in their lives. Jane, thinking back, if you lost your junior and senior year, what that would have meant in high school. And so, Mark, the behavioral health needs have risen up, and you're seeing a doubling of the number of patients. I think we are across the country with enormous amount of challenges in front of us in meeting these. Tell us a little bit about how you're navigating in these very difficult times, and in this particular area of such important need. And it obviously is not just young people; it's across the board. But young people have been so profoundly impacted.
And as you know, this community health center model, we provide primary care, behavioral health care, and dental care to anyone, regardless of their ability to pay. It's not free clinics, but they do get a deep discount on a sliding fee scale. We get federal funding to help even cover those expenses. But we have seen a huge uptick in behavioral health need. I think we employ over 40 behavioral health providers amongst all of our sites. And that's still not enough. We have challenges to where sometimes we have to close panels so they don't take on new patients just so they can treat the established patients that they have now. During the pandemic, telehealth was our saving grace. We actually went from practically 0% using telehealth. And telehealth is basically, using over the phone or video for a call, and went from 0% to 85% in 2020. It was really high. It's gotten that back down to about 30%, but it'll never go away now. Patients have gotten used to it. And, we, like you said, we have seen a huge uptick in behavioral health care needs as people are slowly getting back to a normal life again and coming out and just having a lot of behavioral health issues. We mentioned before, when a patient comes in for a primary care need, the percentages are around 70%. 70% of the patients that come in for a primary care need has a behavioral health issue as well.
Well, Mark, as one of the great deterrents to people accessing healthcare is worries about finances, worries about insurance, being uninsured or being uninsured. And it looks like you've done a great job not only in delivering care after you get people registered as patients, but in getting the Hoosiers to sign up for health insurance through the marketplace, which often is the first step to people feeling like they can go for health care. What has worked from your point of view? What's been your successful strategy there?
Sure. We employ at our larger sites something called an HOA. And I don't like HOAs as far as for where you live, but HOA for us is Health Outreach Advocates. They actually sit down with these patients and discover, hey, did you know that you're eligible for this insurance program that's offered through the state? And so they sign people up right on the spot. We don't have to send them away to some other office downtown. We talked about trust earlier. They trust that the services that are offered within their local community health center. And so the more services we can offer in our doors, the more they're going to take advantage of the opportunities there. We've seen huge upticks not only in primary care, but behavioral health care and dental services. We've actually had records the last 2 years. We've went from a record in 2020 of 94,000 visits and about 25,000 patients. Last year, we went over 102,000 visits and 26,000 unique patients. So the need is out there, and we're just scratching the surface, sadly. And like Mark had mentioned earlier, this community health center model nationwide is now over 30 million patients that are being seen at a health center across the country.
Well, thanks so much for the work that you and your team do. And, patients have worries, and Mark, you probably have some worries, and Jane can hold her ears while I'm asking this question. How many nights are you up thinking we better not mess anything up? Jane's name is on the front door.
Yeah, I've had conversations with Jane about that. Here we just got we've done this with no marketing strategy, and this year we actually brought in a marketing team to help us to even take it a step further. And sadly, when you get into marketing like that, you start getting into copyright, legal stuff, and things of that nature. So I've had to contact Jane and say, okay, they're wanting the copyright logo or name or whatnot. So we're ironing that out. But I remind all staff that the new tagline I use today, we've grown so large that just today, we're going to have 400 people show up at a Jane Pauley Community Health Center door at one of our sites. So we have 400 chances to change somebody's life, and we hope we change it in a positive way.
Mm-hmm. Mm-hmm.
Well, that is spoken with true health center spirit, and I want to acknowledge that our organizations both have been around for a while. We will celebrate our 50th anniversary in May of this year, and I think that was just a few years before the Pauley Center started. But as we hit that 50th mark, we're really looking at what's on the horizon, and we have our thoughts about where this movement is going in the United States. Today, 1,300 organizations, almost 30 million patients. But where do you see this work of primary care, really high quality primary care that is accessible to people in their communities? Where's it going from your perspective?
Well, as Jane would probably attest, people's told me to slow down, but we keep expanding because we know that the need is out there. And so I have a hard time saying no if one of our hospital partners comes up and says, hey, I see how it's working there on the east side of Indianapolis. We want that to work in our communities. And so we're always open to that. But as we all know what's going on right now, we call it the Great Resignation. There's a lot of nurses and other folks that are just getting out of healthcare. The burnout rate is so high. We try to do best we can to honor our current employees and let them know how important they are, not only to us and our organization, but for the community and the patients that we serve. And so that's one of our dangers. If there's anything that keeps me up at night is thinking about people actually leaving the healthcare field and having to replace them. So because the crop of experienced healthcare providers is growing slimmer and slimmer.
Well, we haven't said it enough. We certainly want to thank all of the healthcare workers, not only in the community health centers, but all across the country. Let me just get one final question in for Jane before we go. The media have an important role in educating the audience, and we so enjoy watching you every week on CBS Sunday Morning. In your award-winning career, what changes have you seen in how mental health stories are covered and presented?
I still see the momentum even now. As the host of Sunday Morning, the show may be built and changed according to events, so that I oftentimes see the show at the same time viewers do. And one recent Sunday morning, watching the show, realized that there were 3 separate stories, profiles that featured some aspect of emotional or mental health. whether it was a celebrity or an ordinary person, the context in each of them were quite different, but three. And I wondered, when did this happen? Then I recently appeared as a moderator on a panel with three people from the business community. That's a frontier that's kind of new. And two CEOs of big, successful high-tech startups. These were, in particular, two men in their 30s, 40s, who were being open about their issues. The changes are happening so rapidly now.
Yes.
That and I'm just on the sidelines watching it happen.
We want to thank you, Jane and Marc, for your time. Congratulations on the great work that you each are doing and that you are doing together. And thank you to our audience for joining us. You can learn more about Conversations on Healthcare and sign up for our email updates at www.chcradio.com. Thanks so much for joining us.
Yeah, we really appreciate both of you. Marc, congratulations on all your work. Jane, thanks so much for the support you've given in Indianapolis, but also the hope you've given to all of us across the country that there are strong advocates like you who will help us speak truth to power and encourage more people to take note of the work that we're doing. So thanks, both of you.
So
and thank you.
Be part of the movement.
Appreciate it.
Thanks for having us.
Take care.